Begin.
So, what do you guys think herpes has in common with cancer? Anyone? Part?
They're both diseases.
Fair. Neil?
They can both be very painful.
Fair.
You
Anish?
could die for both of them.
Okay. So, believe it or not, the horrific herpes virus holds potential to combat stages 3B to C metastatic melanoma. But before we get into herpes, let's get some background information on melanoma. So melanoma is skin cancer, and it's caused by overexposure to sun and UV rays. 120,000 people are diagnosed every year with some form of melanoma, and over 9,000 deaths annually in the U.S. alone are attributed to melanoma. So stages 3B to C melanoma have very limited treatment options. Two of the major ones on the market are called dacarbazine and high dosages of interleukin-2. So dacarbazine acts similarly to chemotherapy, and it adds alkyl groups to the DNA of the tumor cells. And high dosages of interleukin-2 works similarly to our drug by eliciting an immune response from the body, but its major downfall is its high toxicity, which leads to blood leakages into organs. And the major downfall of dacarbazine is its low DRR, which stands for durable response rate, which basically just means either partial or full response.
So how is TEVA different from these drugs? Well, TEVA is an oncolytic viral therapy. Oncolytic viral therapy is a new way of treating cancer in which scientists genetically modify viruses like the polio virus. But in this case, scientists genetically modify the herpes simplex virus to elicit an immune response to attack cancer. Rather than targeting a specific aspect of cancer cells like the cell receptor, viral therapy causes cell lysis in cancer cells. So before we go into how TEVA works, you need to know a few terms. Cancer antigens are remnants of the cancer after it has been lysed. GM-CSF is a growth factor that recruits dendritic cells and T cells to tumor cells. Dendritic cells are cells that process antigens and recruit T cells, and T cells are white blood cells that decide the body's immune response to specific pathogens.
And we're going to be...
What is getting lysed?
The tumor cells are, well, we'll get into that, the tumor cells are being lysed, so they rupture.
Basically, they're exploding. And we're also going to come back to these terms throughout the presentation, if you guys have any further questions. So why use herpes simplex 1? So our drug TEVA's official name is talmogene marhurparvovec, and it's basically genetically modifying an HSV1 virus. So the difference between TEVA and HSV1 is it's taking the HSV1 and it's deleting 2 genes and it's adding 1 gene. So this is a little bit complicated, so we're going to go very slowly. So the first gene that they delete is called ICP34.5. So ICP34.5 promotes viral replication in any cell. And there's also something called pCNA in all replicating cells, healthy replicating cells, and obviously tumor proliferating cells. So pCNA's job is it promotes viral replication in the absence of the gene that we're deleting, ICP34.5. So by deleting this gene, it's promoting tumor selectivity in just replicating cells. So this means that in healthy cells that aren't replicating, there will be no viral replication at all. But this also means that because it's also replicating in healthy replicating cells, the virus will replicate a little bit in healthy cells as well, which explains where the side effects come from. The reason why it proliferates so much, or the virus proliferates so much in the tumor cells, is because there's much higher levels of pCNA in the tumor cells than in normal healthy cells. And the other gene that's deleted is ICP47. So ICP47 is a gene that inhibits antigen presentation, and antigen presentation is vital to our mechanism, which we're going to explain a little bit further on the next slide. But basically, we need antigen presentation because eventually the T cells are going to bind to the antigens, and if they're not presented, they can't do that. So we need to delete this gene so that the
these genes are deleted and replaced by the GM-CSF gene, and we'll get into that function here.
Any questions on how these genes are deleted?
Yeah.
Like, I get, is like the herpes like the closest thing to what they want, or like, are there other like different things out there that don't have these like have the two that you're getting rid of, like?
Well, they use other viruses, but like our journal focused on herpes simplex virus. Like they just.
And they said comparatively speaking to other strains of herpes simplex viruses and adenoviruses, herpes simplex is the most successful. Yeah.
Can you just clarify like what the correlation is between ICP and BCMA?
Okay.
ICP?
So, in normal cells, ICP 34.5 would take care of all viral replication. But in replicating cells, PCNA also can do this. So if we don't have ICP 34.5, then the virus can't replicate at all in non-replicating cells, and it can replicate in tumor cells and some healthy replicating cells as well. Does that make sense?
Any other questions?
The virus deletes the ICB3
No, the scientists genetically modify it, so they delete those specific genes.
from the virus?
Yes.
Okay.
And they add GM-CSF.
Can we take your other questions later? Okay.
We'll come back.
So the way TEVA works is it's a dual mechanism. When TEVA is directly injected into tumors, it causes cell lysis. However, the second part of the mechanism is where TEVA also helps the body recognize that cancer is a threat. So therefore, tumors that haven't been injected directly with TEVA are also affected.
So we're going to break down this mechanism a little bit. So TVAC is injected directly into the tumors. The TVAC or the virus is going to take over the cell's machinery, or hijack the cell's machinery, and begin rapidly replicating its virus. And the virus replicates so quickly and so profusely that the cell explodes because it can't hold all of the virus. And after the cell explodes, it releases antigens. Does anyone remember what antigens are?
Signals that inhibit cell replication. Like not division.
It's,
Fragments of the gene.
yeah, it's just the fragments of the cancer.
Okay.
Okay.
Okay, so the second part in the way TVAC attacks cancer is eliciting an immune response and utilizing the body's immune system to attack cancer. So basically they do this by using GM-CSF. GM-CSF is a growth factor or cytokine that signals the replication and recruitment of dendritic cells to the tumor. So GM-CSF is already present in the body, but because TVAC also encodes for GM-CSF, it produces GM-CSF in the tumor. So therefore, there's a high protein count of GM-CSF in the tumor. So because of this, there's a lot of dendritic cells recruited to the tumor.
Okay, and then these dendritic cells are then going to recruit T cells, and the T cells are going to the T cells are going to readily bind to the cancer antigen, and their receptor, their TCR, when it binds to the antigen, it's going to conformationally change, and this change in conformation makes this T cell cancer specific. So this is the really interesting part of the dual mechanism. Now that T cell can go throughout the body and look for uninjected tumors that fit that conformational change of its receptor and recognize that it's a cancer cell and begin attacking that as well.
Okay, so this graph basically shows how TVAC increases the amount of antibodies in your system. So the numbers down here are just the patient numbers, and the numbers up here is the amount of antibodies, and each colored bar is like the different week that TVAC was given to the patient. So as you can see, like the general trend is that the bars are higher, so that means that the amount of dendritic cells and T cells in the body are increasing.
Yeah, dendritic cells and T cells are antibodies.
Any questions?
So like the fact that it's being injected into one tumor causes there to be more dendritic cells, and they're going to find the other tumors that you didn't inject with
Yes.
it? Okay.
Like the dendritic cells recruit the T cells, which are able to recognize cancer. So when the T cells are dispersed into the body, like throughout the body, they're able to recognize other cancer, like tumors that
It's
haven't
more
been
the T
injected.
cells than the dendritic cells.
Okay, so like you only have to inject one tumor, but then
Well,
the T cells will get the rest.
Theoretically,
yeah,
yes.
but in our paper they injected it in several.
Okay.
Can we take a question later? Next slide. Sorry. Okay, so the graph on the left shows how TEVA actually decreases the size of the tumor. So the yellow line is the control group in which patients didn't receive any treatment. The blue line is where patients just received GM-CSF, and the pink line is the shows where patients receive TEVA. So as you can see, the pink line shows like a very big decrease in the size of the tumor. So that just proves that TEVA actually works in reducing the size of tumors.
Yep.
What are those black lines like in the graph supposed to represent? Is that like the range in which like the tumor diameter?
That's just to compare the days. On the same, like on the 28th day, with TVAC alone, the diameter of the tumor was here with TVAC and here with no drug. So the graph on the right shows the surface of the skin 18 days or 18 weeks prior to injection, and as you can see, most of the tumors are gone and the ones remaining have not proliferated. And then this is a scan of the tumor, and the focal point of the picture is the circle tumor. All of the white spots are tumors, and they've all shrunk in the comparison, but the focal point, the circle tumor, is completely gone.
So I'm kind of confused with the bottom graph. So it was just targeting this one.
No, it's just showing. Okay, so all these white lines are tumors, but they're just showing that this one specifically disappeared after the
That's just the most effective case.
Okay.
What about the other? I mean, the others you can tell are smaller, but why did it work the best on that? Just
we don't
because.
know.
We don't know.
Yeah. Can you take your questions later? Sorry.
We only have like 2 slides left.
Okay, so also keep in mind that even though TVAC shows that it does decrease tumor size, only 26% of the 400 people who participated in the phase 3 trials responded positively. However, 11% of the 26% showed complete tumor disappearance.
Which compared to the drugs we talked about in the beginning, dacarbazine, which had a 5 to 15% DRR, this is pretty significant. And just to clarify, this phase 3 trial was done in March of 2013, and it was a comparison of GM-CSF alone to TVAC with GM-CSF coated in it.
So even though TVAC shows like a fairly low response rate, scientists have decided to try like a cocktail combination with ipilimumab, and that just targets the cancer cell receptors, so they think that that will show great promise.
Some other research has been done in the past exploring TVAC as a treatment option for head and neck cancer, which is SCCN cancer. In 2009, Biovex had a study, or had a phase 2 trial done, and in the trial it was fairly successful, and they started the phase 3 trial in 2010, but in 2011 the drug was bought by Amgen, and following this Amgen halted the trial without giving any further explanation.
And using TVAC, there are just minor side effects which resemble the flu, which are just chills, fever, and headache. And in conclusion, TVAC is just an oncolytic viral therapy that was modified of herpes simplex virus that not only causes cell lysis in tumors, but helps your body recognize the difference between healthy cells and cancer cells.
Thank you.
Questions?
Can you go back to the slide? What are the different colored lines?
Okay, so the yellow line is the control group, and that means that the patients didn't receive any treatment. The blue line,
So their tumor's getting bigger.
the blue line is where patients receive GM-CSF, and the pink
Alone,
line,
just GM-CSF.
and then the pink line is where patients receive TVAC. So TVAC has like the smallest line, so that just shows that TVAC was most effective in reducing tumor size.
Yeah, I have 2 questions. One, so when you're talking about the deleting the genes, how exactly do they delete the genes from the virus?
I'm not sure specifically how they genetically modify them, but yeah, we don't know.
Yeah, it's just how they do that.
On the graph, why did the next one, sorry, why does it start at 0? There's no. Why are you giving them why are they giving them these drugs if there's no tumor? It's at 0.
Yeah, it starts at 0 millimeters.
So there's no tumor. What?
Because I think they break it
No,
up.
no, it's already changed, I think.
No, it's just
Size, yeah.
I don't think they start giving them GM-CSF. I'm not positive.
Yeah. Oh,
I think this is just the tumor growth, and then they start an injection there. That's what it looks like on the graph, but we don't know.
So with that, does it mean like that? So like I guess it's around 7 days. So then it's like a tumor that developed in like 7 days. I'm kind of just confused on like.
yeah, the graph
tumor
is
growth.
slow.
I'm wondering, like, does the tumor really shrink, or does it just not expand at all?
It shrinks. It does
It
shrink.
looks like it starts at like either 0 or 5 and ends at 6. Like they all go on.
Well, essentially, like, it's supposed to show that TVEC shows TVEC is like the most effective compared to the other two, but
The cells aren't even shrinking, they're literally exploding.
like essentially the tumor's actually dying. So
So, is it good to have? I mean, it's not good, but like, is it okay to have antigens in your body?
Yes, antigens are a good thing
They are
because
good?
without the antigens, you wouldn't have the T cells bind to the antigens and then spread or like become cancer specific and then be able to attack the other uninjected tumors.
I'm a little confused about the mechanism. I know that TVEC is injected into the tumor, but from then on, I'm not quite sure how they relate to T cells.
I won't say all these right. Okay, so the virus is going to be injected into the tumor. Once it's injected into the tumor, it's going to hijack the cell's machinery. It's protein making machinery, and it's going to start replicating its own virus. And the virus is going to replicate so much and so quickly that the cell literally is, or the tumor is literally not going to be able to hold it, and it's going to explode. Does that make sense?
Yeah.
also like remember that the TVEC is able to replicate in tumor cells because there's a lot of PCIA present, and we talked about in like the other gene slide. So that's why the virus like replicates a lot in tumor cells, and that's how it ruptures.
Do you want us, we can finish to get to T cells, we haven't gotten there yet.
Yeah. That'd be helpful.
Okay, so then after like the cell ruptures, what's left of the cancer are the antigens, and remember that GM-CSF is a cytokine and it signals like the recruitment of dendritic cells, and dendritic cells recruit T cells. So because there's so much GM-CSF present where the tumors are, the dendritic cells are recruited to where the tumors are, and they're able to fight off cancer there.
Do you understand what GM-CSF is?
It like recruits the
Dendritic. Yeah.
dendritic cells.
How is GM-CSF sorry,
It's encoded. It's genetically
It's like
encoded into
so
the
the
virus.
genes that were deleted are replaced by the GM-CSF gene.
How do you, in your graph, show that they had GM-CSF alone? How do you get GM-CSF in if it's vector is, or not vector, is a gene inside TVEC?
They just like gave GM-CSF without like in the virus. I'm not exactly sure like how they did that, but it was just not, it wasn't encoded for that line.
GM-CSF has been used alone to beat cancers for a long time. The TVEC combined with GM-CSF, so the new component.
What happens to the TVEC virus after the cell ruptures? Does it just stay in the blood?
We're not sure, but it would make sense for the virus to then travel to other cells and attack. We don't know.
Can you go to the pictures? So in the bottom right, you call those circle the focal points. That's where they injected TVEC in.
Yes.
So that's why that one's probably disappeared the most out of all of them.
And the fastest.
Is that, where is that just?
It's just a
Bottom right,
So
yellow
it
circle.
hasn't like touched any of the other stuff. So that's like the only one that's really like changed. So is that the only one that's even like affected? Like, is the stuff around it?
Well,
was
these
that-
other white lines, they're kind of reduced in size
They've
as
all
well.
shrunk.
Okay.
Yeah,
So
the bottom
it's like
one's
okay.
How they stop the virus from overreplicating? the virus from over-replicating in healthy cells.
In healthy cells?
Or not in healthy cells, but overall for the body. This treatment kind of involves viruses going all through your body, and that may be harmful.
Well, the virus only replicates in replicating cells because that's where the PCNA is present, and the virus is dependent on the amount of PCNA present because that's what drives that replication.
Let's say you have melanoma in a lot of places, so you'll have viruses all throughout your body, and that can be complicated.
Well, the virus itself, this virus specifically, isn't that harmful. Like the side effects of herpes, or just side effects of TEVA in general, are just headache,
Chills,
fever.
And you carry herpes with you for the rest, like that version of herpes with you for the rest of your life.
Sorry.
We don't know.
Okay.
So like, where exactly in the cell cycle is this all like happening? Like, is it like kind of single apoptosis, or is it like kind of
So basically, like, this doesn't really involve the cell cycle. The drug itself just utilizes the body's own immune response to attack it. There's no like apoptosis or anything. The way the cancer cells are ruptured is because of the overreplication in cancer.
So it doesn't really affect the cell cycle.
So it's like happening like, say, just like within like 4 plus units.
Yeah.
Okay.
How effective is this treatment overall on people? Like what percent of people like responding to this treatment?
26% had DRR.
You guys should be out there and answer questions for the next one. Thank you guys. Step up.
Yeah.
Did you just hear her? I'm so happy we're done.
Quiet. All right. Discussion time.
These the head track. With your question, doesn't they say that TEVA once it does the antigens have a conformational change, so it specifically targets the tumor cells? And wouldn't that be how it not targets?
I think
The way
part
they target the tumor cells is by it just targets cells that are dividing. There are cells dividing everywhere. And let's say you have the cancer all over your body, then you have the virus.
I don't think that's targeting. I think that's
It's not targeting, it's only replicating.
yeah. It's targeting. It's not targeting tumor cells. Its effect is only in tumor cells.
It's dividing cells.
Right. So it's attack. It will theoretically inject the GM-CSF into all cells, but with only cells with PCNA will it then explode? PCNA is the DNA clamp. It's
But
the,
only
so they
cells-
took out the ICP 3.4.5. So PCNA is ICP 34.5 in your cells. So this virus is missing that piece, and only cells that are replicating have that piece.
Oh, isn't there a virus?
So it can only replicate cells. So
The virus can only replicate in replicating cells.
I know.
It works like a chain reaction, right? So if there are a lot of cells replicating, well, there'll be cells replicating in the tumor, so it'll grow there, but there'll be cells around it that aren't part of the tumor, they're healthy cells, but they'll be replicating, they'll spread. So won't it spread all around it and increase it?
No, because replicating cells will be wiped out.
Will that have more negative side effects if they tested?
I can't answer that. So neither can you.
I can't, that's what I'm asking.
Right, what I'm saying is, it might, it may not.
It would be like shutting us off.
Are you taking notes?
Where do you want me to
I
take the
don't
notes?
understand how they would not get herpes. Like,
It's not herpes.
Also, I don't
Herpes is just a syringe.
It's like herpes.
it's where you put it.
oh, but like,
Herpes is just a syringe. It's just a shell. It's what you're putting in the shell that's important. You're putting GM-CSF in the shell.
so are they getting like the two things they're taking out? Is that getting rid of all the negative effects?
You're not getting any.
They're not getting herpes.
They don't get.
Okay.
That's like saying if I put AIDS in a needle and then I injected you with it and you got, well, if I put HIV in a needle and then injected you with it and then I took another needle and I put vitamin D in it and injected you with it, saying that syringe is like HIV.
Okay.
It's not. It's just the mechanism.
Is it, so I asked Sophie whether it's good to have antigens in your body. It just doesn't seem like that would be good. Is it okay to have?
You have millions of antigens.
But is it okay to like purposely create them? They're exploding. They said they're exploding a tumor in your body and
Right.
creating them. Is that good for you?
Well, I